Delhi Chief Minister Arvind Kejriwal has said that the number of tests for COVID would now be doubled. Now, this comes in the midst of Delhi witnessing what seems like yet another surge in the number of cases, a sudden spike. Yesterday, I think the cases were more than 1,500.
Yeah.
So what is leading to this spike? Does it mean that, the safe period is far from over, and does it mean that unlock is creating such a surge? These are the answers that Abantika Ghosh, who tracks health for ThePrint, will try and give us today. Please do send in your questions. Abantika, so what are the figures like for Delhi? If you can just give us context about how we are saying this is a spike now.
So there were two lows that Delhi hit. One was on the 11th of August and the other was on the 17th of August. One was 727 cases, the other was 740 cases. After the 740, it's been almost consistently going up. The last 3 days, sorry, that's wrong. So the lows basically was 652. The low was 652 on the 16th of August and 17th of August was 787. These were the cases. I was looking at the daily recoveries actually earlier. And in the last 3 days, the numbers have been, so today the number is 1693 cases. Yesterday it was 1544. The day before it was 1061. So it's consistently
increasing.
Yeah, there's a curve.
Upward graph.
Yeah, there's a curve. However, the deaths are still, last 2 days, today it's 17 deaths, yesterday was 17, day before was 13. So the deaths are still relatively low, which is a good thing. Even though because of the earlier deaths, the cumulative case fatality rate of Delhi is actually far higher. It's 2.62 and the national average is 1.82.
Right, so much higher than the national average.
Much higher than the national average, but that's more because of the earlier deaths than what's happening now. But yes, the numbers are definitely going up very steadily. Also, the tests have been kind of going up and down, but since the 9th of August, they have been going down. The only time after the 9th of August when Delhi hit 20,000 tests, there were 2 consecutive days, that was 18th August and 19th August. So basically after 19th of August, Delhi, and today is the 26th, in the last 1 week, there hasn't been a single day when Delhi has tested more than 20,000 samples.
Right. So yesterday the Chief Minister said this would be taken up to 40,000.
That's right, yeah.
How feasible is that?
I suppose that is, it's feasible. It's not the feasibility that is the problem, but what the problem will be is, and this is something that has got immediate repercussions on what is happening right now. What is very important is, what are you testing? Are you doing RT-PCR tests or are you doing antigen tests? Because the last for several weeks now, maybe 7-8 weeks, even more than that, Delhi has been doing almost 3 times as many antigen tests every day as RT-PCR tests. And RT-PCR, as they say, is the gold standard. Antigen tests can have
false negatives.
And I was just talking to a very senior person, and he was telling me that antigen tests can miss as many as 50% of cases. So when you and also there is a lot of asymptomatic. So right now the protocol itself says that negative antigen test will have to be tested with RT-PCR only if the person is symptomatic. But with so many asymptomatic cases, that protocol itself is a bit problematic. And also, we did a story a while back when the DMs of the various Delhi districts told us that people get so happy when they test negative with an antigen test, they don't come back for the RT-PCR even when they need to. So, the number of tests that actually go on to do RT-PCR, a negative antigen test, that's actually a very small fraction.
Must be those who really witness symptoms and are forced to go back.
Right, and who are really scared. But most others, negative aa gaya, baat khatam. It's that sort of thing.
So Abantika, what has really led to this spike? Because this is a cause of concern. Is it because as gradually we are unlocking more and more, is that causing the spike? We did a Government Matters a few days ago about how the younger generation is driving India's COVID spurt because of the unlock, how we are unlocking. So is that the cause in Delhi as well, or?
Many causes. That's definitely one cause, because as you unlock, it will obviously go up. Then the Delhi government says that because of the unlocking also, so normally what happens is Delhi is it's sort of a magnet. So from across the NCR, patients come to Delhi for treatment. That's been happening for years. During the lockdown, that movement couldn't happen.
Restricted.
Movement couldn't happen. People couldn't come. Then Delhi government put restrictions on whether you can avail health services in Delhi hospitals. But all of that is now over. So there are a lot of cases that are coming from Ghaziabad, Faridabad, all these NCR
Gurgaon.
areas. Gurgaon, that's right. So all of these, that's one. Then we have all these flights that are coming in, the Vande Bharat flights. Many of them would need to be isolated, tested. That's another factor. But what is also a factor is before I come to antigen test again, which I think is a very important factor here. The third factor is, in this week's briefing, when we asked about young people spreading the disease, Dr. Balram Bhargava, who is the Department of Health Research Secretary, his reply was, I wouldn't say young or old people are spreading the pandemic, it's the irresponsible people spreading the pandemic. Meaning that people who don't use masks, who don't practice social distancing are sort of to blame. But now that these numbers are showing, we also have to keep in mind that a person who is asymptomatic and has tested negative in an antigen test, for argument's sake, suppose that person that's a false negative and the person is asymptomatic, but that person will spread. So that pent up sort of spread, transmission, that will show. And also I mentioned in the beginning that the deaths are not that high number, but there is a lag in the number of cases and those cases actually reaching that conclusion, that unfortunate conclusion. We've done that story that there's a 15-day lag. So it is perfectly possible that the numbers, the spike that we are seeing in cases right now
will reflect later.
Start reflecting 15 days later in the death figures. So that is probably one of the reasons why the Delhi government has decided that we should double our tests.
Right. So, Abantika, what have the sero surveys about Delhi told us so far? I mean, does it, because there's a spike in cases, does it also show that there are a lot of many asymptomatic cases which are perhaps not coming to light?
Yes, absolutely. So the first sero survey that NCDC did, that was in late June. That survey showed 23%, 22 point something. And this one, the last one that the Delhi government has done, that shows 29%. So it is going up. And clearly, and this is something that nobody in the government, howsoever you may ask them the question, will never admit, but clearly your testing strategy is missing these cases. Now, the argument is that medically a case is only a person who shows symptoms, so these are not cases, these are infections. But for our purposes, for a lay person, you have missed these many infections. Whatever the reason.
Because they would have gone and infected other people.
That's right. They would have gone and infected other people, and you don't know what outcome those other people had. So the sero survey again is showing that, again, the same thing that I said in the last Government Matters, that we really need to open up testing. Like yesterday, Kejriwal said that you can go to any government lab or hospital and get tested, but you'll be asked questions. You will have to show that you have a contact history, you have symptoms, you have a travel history, all of those things. But what if you don't have any of that?
Right.
And right now there are cases everywhere. The MOS home just said that he has tested positive. So it's sort of, and also I think a very important thing is Delhi did that early on, but I think right now we are at a very important stage in the pandemic when the government should just come out and say there is community transmission that will give.
This has been in denial for a long time.
Yeah, and Delhi actually said that. The Delhi Health Minister said that, I think in May or June, Satyendrajan actually said that, and then 2 days later they said that no, it's for the government of India to declare. This is not a bureaucratic thing, and it's not a matter of shame. It's a legitimate stage of a pandemic that you just see that there is community transmission that will, if you're alleging that irresponsible people are spreading the pandemic, then that will instill some sense of fear.
Right.
And maybe people will be more careful.
Right. So let's, Abantika, begin by taking Soumya's question, who wants to know, will the spike hinder the reopening of the metro? So, the Delhi metro is going to open in unlock 4. Is this going to be unlock 4? And now with the cases spiking, is that a concern?
Yes, that is certainly a concern. This is a very fuzzy area so far as the government is concerned, because we've asked them in various ways at various times that what are the indicators that you will look at. Do you have something in mind, like if my cases are this many, I will open schools, this many I will. There is no clarity on that. So if the spike continues and this goes on, and by the way, a lot of experts are saying this is not exactly a second wave. It is the continuation of the first wave, like a fever that goes up and down. A pandemic also does that. But yes, this will certainly have implications about opening up, how much to open, where to open, how to open, what are the protocols, all of that. This will have implications.
Right. Ankur Chauhan had a similar question about what it meant for unlock 4, which you've already answered. Pawan, are there any false negatives for RT-PCR tests, which you said is the gold standard?
Yes, there can be.
There can be.
There can be false positives, false negatives. That is possible.
Right. Tanveer Panjwani, is the Delhi government manipulating figures?
I wouldn't be able to say that. I can't say that.
Okay. Pawan Pingle, here's $1 million question. Have we reached the peak yet? So each time it's like, have we reached the peak, and now are we going to see a downward graph? But clearly that doesn't seem to be happening.
No, that also we don't know, because we thought we'd reached a peak. Now there's Kerala, for example. It's a very good example. Kerala thought it had reached a peak, and look how it's come back. It's come back in a way that was never there in the first wave. So we actually don't know when we will reach a peak. We don't know how high the peak is. We don't know any of these things. All we know is that India right now, for many days, we are reporting the most number of cases, daily cases in the world every day. Today we have reported more cases than any country ever in a single day has reported, 75,760 cases. So we are scaling new highs every day. That is very clear. But where the peak is, nobody knows.
I think it's going to be difficult to know the peak till you actually witness a steady downward graph, and then you can say that was the peak.
Exactly, and that is why a peak in infectious diseases is so important. That is why this yearning for a peak, because it will then
show a downward trend.
That's the only time you will know when it actually is consistently. That's what even experts were warning when all of this thing was happening, like Delhi is really good. Everybody was saying that you're rejoicing too early.
Right. There's a question from Rahul Benakupad. What about reinfections? Now that has emerged as a new cause of concern. We've seen that there are now confirmed examples of reinfections.
Right. So Hong Kong had reported that, and when we asked this Tuesday, we were told that India is looking at it very carefully, but it's just one case. But having said that, this is a very interesting thing, because I go to the health ministry very often, and I know for a fact that one person who was positive some months ago has now tested positive again. But when I asked that question to the health secretary at the briefing, he said it's a hypothetical question. He didn't deny it. It's a hypothetical question. But I know this because my sources are telling me, and these are people who sit in the ministry. They are themselves very worried about this, that there is a case of reinfection apparently.
So that also puts a big question mark over vaccines.
It does, but also a case of reinfection would also have to do with, like I said, RT-PCR can have false positives. What if the earlier test was a false positive? That's also a possibility, because some time back in Apollo Hospital there was a case, and when we spoke to the doctor actually said that it is possible that last time he was tested because of contact, and that test was false positive. This time he has symptoms, he was tested again, now he's positive. So that could apply for anybody. Now reinfection is not impossible. However, it's like the official stand is, and I kind of believe that it's unlikely.
In such a short duration.
Such a short duration of time. Also, in viral diseases, usually reinfection, even if it happens like over a far longer period. So, for example, for seasonal flu, you have a vaccine, but it changes every year. The specifications of that vaccine changes every year. So, which means that you have to sort of keep revising as according to the virus or bacteria that's around.
Right. There's a comment from Sai Vijeta who says there's India beyond Delhi. Please cover the mismanagement in Telangana. Well, Sai Vijeta, you know, The Print has been covering the pandemic extensively across the country. Our battery of reporters have fanned out from Nagaland in the east to Gujarat in the west. Telangana and Andhra, our correspondent Anisha Bedi spent over a month, I think, to report from there, and she has reported on the mismanagement there as well. So please do log on to our website, theprint.in. It is really our endeavor to try and bring you stories from not just Delhi, from outside Delhi, from
even
the
done
ground
stories from Andaman.
Andaman, yes. So we've really been covering it across the country. So please do log on to our website, theprint.in, for that. Viranj Bhanushali, is it time to open schools now? If not now, then when? That's a big question.
See, whenever all these informal stakeholder consultations happen, states, parents, nobody wants schools to open. And you know, if I have spoken to parents in my own circle, and they're saying we're willing to lose 1 year, but how do you make kids understand social distancing?
Right, you can't. It's very difficult.
It's not possible. And also, I think maybe what could be an option is that you call the older kids who are
more sensible,
and also who will suffer more because of a loss of school year and you know, so practical exams, practicals, the lab work and all that. So maybe that is a possibility at some point of time, but it is a very sort of
tricky
terrain. But again, the insistence on exams.
Right, and you know, this is such an unprecedented circumstance that one really has to treat it as an exceptional circumstance. It can't be that children have to complete school and one can't lose a year, etc., etc. It can't be treated like any other year at all.
Right.
There's a question from Lalit. Is herd immunity the only strategy? Are we reaching herd immunity? Have the Sero surveys told us that by any?
No. So, see, we don't know where herd immunity is. But it cannot be less than 60%, 70%. At a Sero survey of less than 30%, you already have the third or fourth highest case fatality rate in the country. How many deaths are you looking at then? It's a very expensive strategy.
Right.
In a crowded city like Delhi, it's going to be a very, and it cannot be a strategy, frankly speaking. You know, herd immunity is a strategy only when you have a vaccine.
Correct.
So vaccine will work with that herd immunity concept. So if you cover a certain percentage of your population,
some have herd immunity,
then herd immunity kicks in. But without a vaccine, to go the Boris Johnson way,
right,
you will pay Boris Johnson's price.
Exactly. We saw what happened in the UK. There's a comment from Amit Agarwal. The unlock across the country is almost a complete reversal of all restrictions. The question is, what should we do so that people can, you know, what is it that people can do on their own to protect themselves? So, Abantika, this is, you know, I think from what I understand about this question, all of these restrictions at some point would have to be removed. Is there enough consciousness that people have developed to take precautions on their own? Because at some point, the government has to stop playing headmaster.
And I think that to actually take that argument a little forward, the government playing headmaster has actually hindered the learning process. Because when you do something with a stick, your natural impulse is to violate. Whereas, so one very interesting thing in all of this I find is that when we are unlocking, I see absolutely zero public health communication about masks. There are no hoardings, there are no advertisements, nothing. Then masks, you wear a mask. And how many masks you see strewn on the roads when you go for
disposal is a big problem.
Disposal is a big problem because you're not telling people. This is a lesson, the lesson about how the virus spreads, this thing of, you know, contact and all of that. that has to be really, really drilled into people's minds, and public health communication is the only option. Police, and I've said this many times, police cannot be the agent of public health communication. You don't do public health with police.
Right. Right.
That's a huge problem.
Right. So there's one YouTube user who had a question on community spread, but you've already spoken about it. I'll take one last question from Shubham Joshi. Our daily cases are rising for the last 5 months, whereas all other countries have seen some drop. What are the gaps? Are we not scaling testing enough?
We are scaling testing. Our current capacity, so we started with 10 tests per day in January. That was our capacity. We could just do 10 tests. Right now, we are capable of doing 1 million, 10 lakh tests a day. I think it's not the scaling. I think partly, yes, scaling up. What we now need is opening up. We just need to open up testing. We do on-demand testing. The problem with that is, do we have the resources? Do we have the reagents to open up that sort of testing? There are some new kinds of testing methods that are coming up that will shorten the complication of all this transportation of the sample and all of that. I think that is important. Also, increasingly our testing, Delhi is an example, many other states are. Uttar Pradesh is almost, I think, doing 30-40%, and Uttar Pradesh is doing a lot of testing. They're testing almost 1.4 lakh a day, but they're again doing a lot of antigen tests. This propensity to increase total tests with a lot of antigen tests are only meant to be done in containment zones and healthcare settings before a procedure.
Right.
This overwhelming dependence on antigen tests to show inflated numbers, this has to sort of be rationalized at some point.
Right. Well, as Abantika pointed out, one really can't say when Delhi will reach its peak, whether this is the peak or whether the worst is yet to come. But the reality is that Delhi has witnessed a sudden surge, and the only thing that can be done, as she rightly pointed out, is to make people conscious themselves. Policing, the state playing headmaster can only work to a certain extent, and of course scale up testing, rely more on RT-PCR tests than antigen tests. Thank you so much for watching Government Matters and for sending in your questions. Keep subscribing to our YouTube channel. Do like our Facebook page and also follow us on Twitter.